Hey, what's up, guys? Dr. Luke here. I'll go through a quick little mobility session. Today I'm going to focus on the good old piriformis muscle, or the lateral rotators of the hip. You know, that piriformis muscle, it kind of has some, I don't know, like celebrity status as far as mobilization and function, but there are a lot of other muscles that are around that piriformis that have similar functionality, and but in regards to having some effect on pain or dysfunction or myofascial trigger points, the piriformis can present some challenges. So I'm going to show you a couple different stretches and quick mobilization techniques to really get after that piriformis. So let's dig in. All right, so ultimately that piriformis muscle is going to have an attachment out here on the hip bone, and then it's going to have an origination closer up onto the sacrum, and it helps laterally rotate that hip. All right, has a bit of an extension mechanism as well, but it is partially a stabilizer when we talk about our squat performance and pushing out and diving out in relation to squatting and lunging and any of those functional loaded movements that we do a lot. So let's dig in to a little bit of myofascial release first, then we'll go after some stretching and then maybe some functional range stuff. So lacrosse ball, and that's about it. So let's start with our good old supernova ball. All right, supernova ball. It's a little bit more what we might get into that hip socket. It fits a little better. All right. What I'm going to do, I like to rotate to my side. Some people get aggressive, cross the leg over. I like to just set it out, kind of open up that hip into a bit of an external rotation. And as you've all done, kind of in class, I'm going to let my weight sink deep into that. All right. Because that piriformis is deep to the gluteal muscles, you've got to sink through those to get a little deeper down to that piriformis. All right. The one major thing to be aware about within that piriformis and those lateral hip rotators is that there is a giant nerve there about the size of your thumb called your sciatic nerve. And if you're putting pressure on your sciatic nerve, it's going to be angry. You're going to feel it. You're going to get maybe some shooting pain down the leg, lightning bolts, numbness and tingling. Those are all signs to get off. You need to relieve pressure off that nerve and move somewhere else. Move up, move down, get off it. Within the piriformis, about 30% of people, maybe a little less than that, in some research, will have the nerve running through their piriformis. So in that case, if you are mobilizing it, you're going to have symptoms, I think, regardless. So you got to be smart and maybe not spend too much time there. But what I like to do after I mobilize here, in more of a myofascial technique, right, with what we're doing, and a desensitization of the tone in the hip here. After this, I like to go into just a light, maybe active motion or stretch. So what I'll do, I'll just go into that nice piriformis stretch. I'll come up, come back down. Maybe I'll give it a little bit of external rotation. The piriformis, it can be an external rotator, and it can help with also at some different points with internal rotation. So you'll find that your fact that is an external rotator, but you're also in external rotation, you can still have a stretch through there. I prefer, if I'm going to hit it, where I can get it with this stretch to the opposite knee or pigeon position. All right. So if I'm going to the pigeon, I get hip flexion with external rotation, and I can drive into that. And I like to just drop that hip down and then come back out. If I want a static hold, drop in and hold it. All right. If you can see me a little bit this way, it's going to look like this. A lot of people make the mistake of being too much on their knee, and they get a lot of knee pain, specifically in that medial aspect of the knee. So if you've ever felt that, you need to drop down off that hip here, or have something that you can rest on that supports your weight, so you can take that lever arm off the medial knee. So I'll put an ab mat, maybe a ball. But if I'm going to try to hit the piriformis in this position, it's a little tougher to do, but I certainly can. All right. So you'll myofascial release, maybe with the ball, get into some active and static stretching. You can utilize the figure 4 on your back, pigeon stretch and standing, which your leg is just up on a bench. So after that, I think it's key to try to activate those lateral rotators. You just mobilized, freed up some of that tissue, stretched it out. Now you go into that new range of motion. So some simple ones I think are important. Maybe just some sideline clamshells, all right? Go through that new range. All right, certainly put a band around my knee. All right, I can move into some quadruped fire hydrants where I'm out, and then maybe I add a hip extension and bring it back. These are more of like that functional range conditioning where I'm searching through what I have available all the way out with triplanar movement, all right? So out fire hydrant into hip extension and bringing it back in. Rotate, 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 extend, and come back out, all right? So maybe I would do 2 sets of 10 on those clamshells and the fire hydrant into extension, and then drop into maybe your last functional movement, which would be something just maybe a simple squat. And then you can really kind of test, retest, and see how you feel. All right, so that sequencing, if you're targeting the lateral hip and even deep into the piriformis, would look like this, okay? Before you do anything, you test your squat, you test your lunge, the areas that feel stiff or you have symptoms there. Treat it with lacrosse ball or myofascial release, self-myofascial release, then into a more of an unweighted hip movement, so like clamshells and that fire hydrant into hip extension, and then follow it up with your retest on your squat. That could be a simple mobility session that might take you 5 to 6 minutes if you're battling some lateral hip pain. Try it out. Let me know what you think. If you have questions, reach out to me.